My name is Kristen Lucas, and I'm the chair of the Gorrilla Species Survival Program for the Association of Zoos and Aquariums. The Gorrilla SSP is strongly encouraging all institutions to participate in the Gorrilla Health Project by contributing whatever information they have available. This video is one of several resources provided by the SSP to help institutions obtain cardiac health information on their gorillas.
I am here, I am now, I have been and will be forever. I am truth, I am light, a legacy to remember, garden of time, healer of nations, rivers of truth. I am the rhythm.
Hi, I'm Amy Burgess, a primate keeper here at Disney's Animal Kingdom. Providing the best possible care for our animals is an ongoing commitment. This is why we decided to participate in the Gorrilla Health Project by training our gorillas for voluntary cardiac ultrasound. The purpose of this video is to share the best practices and techniques that we learned while training this behavior. We also hope it encourages others to participate in the Gorrilla Health Project.
Well, the Gorrilla Health Project is really an initiative started by many people actually to look at the health and disease of this species in captivity. It really all came together in 2006 when we were discussing gorilla heart disease, which was kind of an indicator of severe morbidity or mortality in gorillas. Over 33% of the captive population dies from cardiac disease. We've all kind of been working very hard to get some funding and cooperation from all AZA zoos housing gorillas to look at the problems affecting gorillas. And that's basically what the Gorilla Health Project is, bringing data in and sending reports out to help people prevent disease in these magnificent animals.
We're now able to get awake information through training and coordinated work with ultrasonographers, keepers, and veterinarians. This information is going to prove to be invaluable in advancing our knowledge of what normal is, along with what abnormal is. This is a huge breakthrough and step. We're hoping that zoos all around the country can reproduce this activity to help with this National Gorilla Project.
With such a high percentage of gorillas having cardiac issues, the value of participating in this project was clear. To begin with, we gathered relevant teams, such as our veterinary department, our behavioral husbandry department, of course the keepers and the management staff, so we could begin to develop our initial training plans.
This team has been very successful at training gorilla cardiac ultrasound. Some of the speed of achieving success was due to the fact that they had a strong foundation to their program. But this foundation was not critical. They could have still been successful at training all these behaviors without this foundation. Another thing that helped them in their success was the fact that they trained flexibility into their program. It was actually what I would call the personality of their program. It's not about injection case, just showing different props. The keepers were flexible, the animals were flexible because they were asked to be. All the keepers had to work with all the different animals. All the animals had to accept working with all the different keepers. Plus multiple different types of equipment in the area, accepting different people in the area, strangers in the area, and this led to the animals and the people being very accepting of different situations. One thing that's important to mention, though, is when you're asking both animals and people to be flexible, is that this is all supported with strong leadership. Strong leadership is needed because when you're asking animals and people to be flexible, they're going to run into challenges and roadblocks. And they need somebody to encourage them and help them through all these challenges. And that is ultimately what will bring you to success.
So once we decided that we really needed to initiate, step up the monitoring of ultrasounding our animals and just general cardiac monitoring, we really had to decide what that meant for not only the groups, but each of the individual animals. For example, we may have an animal that doesn't have a disease as severe as one, and it may mean a difference in medications. From a veterinary perspective, we have one individual that is on a series of medications that may have some potential side effects, and so we needed to, particularly for that individual, monitor heart rate. And so that was a critical part of not only monitoring his heart rate, but how could we initiate to step up monitoring him ultrasonographically every 6 to 12 months, versus another individual that only had mild disease. Monitoring that heart rate wasn't as critical, so we really needed to prioritize, well, ultrasound was really the first priority for those. So it was very individualistic, and also partnering with the managers and the keepers to decide how can we make those priorities happen with each of those individual animals.
At this point, we needed to find an ultrasonographer. We partnered with our veterinary team so that we could find a technician willing to let us use their equipment so we could get diagnostic images.
It wasn't any sort of magical connection that we made to find our human ultrasonographer. It was literally getting referrals from local ultrasound companies and the cardiovascular human MDs that we worked with to find that link to get to our human ultrasonographer.
I was very interested because I was, curious to see how adult cardiac structures compared to gorilla cardiac structures and the function and just the whole physics.
Our ultrasonographer, Robin, initially demonstrated the techniques to our managers.
I think the best view to shoot for initially will be the apical 4-chamber view, simply because it's the easiest view to understand, and it's also a view where we can capture the most information in a short amount of time. So when we do the 4-chamber view, the indicator is towards 3 o'clock, and we will be, for most of the gorillas, right underneath the nipple line. Every gorilla has different chest habitus. Some of them are more foreshortened, some of them have a longer chest habitus. So it's going to vary as to how close we are going to be from the nipple line.
Our managers made sure that we had their help and the time we needed to do the training.
One of the things that we as zoo managers did was we really balanced our time in order to make ourselves available for the keepers in order to help them train and to be a part of that training. So it was just really prioritizing our day so that we were in the area when we needed to be, and we could also do our other duties. Perfect. Hold that position. You've got a 4-chambered view.
During the training sessions, the zoo managers would be the ones who would be looking at the screen while the keepers would be working the gorillas. We actually had to understand how to find those correct images and teach the keepers how to move the probe appropriately. So when Robin was here the first time, she taught us not only how to find the correct position for each of our different males, but also how to read the machine enough to determine that we were in the correct spot.
We knew that Milwaukee Zoo had had some success with cardiac ultrasound images on one of their gorillas. We arranged for one of our managers to go to Milwaukee Zoo and observe a training session. The information gathered proved to be very valuable for us. We had some concern that we would have to modify our facility in order to get the probe onto one of our gorillas. After observing training at Milwaukee, we knew that this was not the case and we could proceed with training.
A critical component to any successful training program is the active support of the management team.
I think we were set up very well to train this behavior in that we were told to do whatever was necessary with our training to keep the progression going instead of worrying about getting good images right off the bat or holding for a certain amount of time. So we were given the leeway to bridge whenever we needed to so that we weren't inadvertently training the wrong type of behavior. So that really helped us to make some forward progress without getting too frustrated.
So certainly one of, the big learning curves and a daunting task in accomplishing this is the equipment that's necessary to be able to accomplish the ultrasounds. And not only is it to have that ultrasound equipment on property, but also really liaisoning between the husbandry team and the veterinary team. If the veterinarian can't be present for every ultrasound training session, to be able to devise a plan and have that open dialogue of how that equipment can be used for training sessions as well as the diagnostic event.
Okay, you need to move down a window.
Hold.
Better, and now point medial.
Hold.
Go just a little bit laterally. There you go. Hold right there, perfect.
Each gorilla has a different particular placement that the probe needs to be in order to get that 4-chambered apical view. And so what we decided to do was look at all of the males that were our priority animals and find that perfect position.
Robin identified significantly different probe placement locations for each of our males. This required keepers to determine creative positions to allow access to the ideal location while still allowing the animal to comfortably hold his position. One male was able to present his chest straight forward. He was not required to position his arms particularly high in order to achieve suitable images.
You ready? Can I see?
Another male's ideal probe placement was almost directly under his left nipple, causing him to position the left side of his body closer to the mesh. Keepers needed to station his right hand high up because of his tendency to grab at the probe.
No, you were doing it. That's okay. Come here, bud. Nice. Nice chest. Nice job. Can you hold that? No, that's it. Hold it. Closer. Nice. Hold that.
You want to go a little bit more medial?
Good boy.
Good boy.
We had difficulties getting clear images on our largest male due to the thickness of his chest cavity. Because of this, he was required to position his left arm higher than the others in order to open up his rib cage. In order to make this comfortable, he was trained to position his left thigh flush with the mesh.
Good boy.
What?
One male was trained to present his ribs in order to get the proper probe placement. He was then trained to stretch his legs straight out along the mesh. This male frequently tried to take the probe, so his right hand was positioned on the mesh to minimize the chance of damaging the equipment. Our final male has arthritis, which limited the number of comfortable positions available to the trainer. He was ultimately trained to rest his left arm over his head while presenting his chest straight forward. This allowed the rib cage to be opened without asking him to twist his body or hold his arm raised for a long period of time.
Okay.
And working with the gel was a little bit of a challenge for some of the gorillas. We needed to make sure we had enough gel on the probe that there was no air between the probe and the chest. The gorillas were trained to tolerate the application of the gel through successive approximations.
You hold.
Some individuals showed an aversion to the gel and immediately tried to wipe it off, while others tried to consume it before it could be applied.
Hold that.
The gorillas had to be trained to leave the gel in place long enough for ultrasound readings to be taken.
And he has no diastolic dysfunction. That's good. Just a trivial amount of mitral regurgitation. And now we're going to look at the aortic valve. Longer. And this is the aortic valve. Okay, you can release. Good job. Yep. Very nice.
And making sure the probe was not damaged was a high priority.
A couple suggestions that we certainly have approached is developing mock equipment.
I need it closer. Come on, Gino. Come on. Closer. Gino, chest.
Certainly, initially, as you're desensitizing the animals, that can be a great alternative. But unfortunately, at some point, you need to make that leap of faith so that that equipment is being used so that you can see if diagnostic images are being accomplished.
We also realized that getting diagnostic images required two people. The managers would act as the ultrasonographer, looking at the screen and directing the movement of the probe. The keeper would adjust the positioning of the probe accordingly, always being aware of safety for the keeper and the equipment.
When we first started doing cardiac ultrasound with our awake gorillas, we decided that we wanted to desensitize our animals to the equipment and to various people working as the ultrasonographer. So the first thing we did is get them used to seeing the equipment and using a variety of people as the fake ultrasonographers, so zoo managers as well as people who are on the rest of our staff.
So I think really this whole process has been a strong partnership, both with our inside partnerships between our veterinary team and our husbandry team, and also with our outside partners, with our human ultrasonographer and our veterinary consultants through the Gorrilla Health Project, has really brought us to a great place where we provide what we feel like is the best option and standard of care for gorilla health here at Disney's Animal Programs to accomplish frequency of cardiac monitoring in our individuals without an increased risk to the animals, both socially as well as the anesthetic risk for veterinary procedures, has really been critical to bring us to this point. And most importantly, as we gain this information and are providing what we feel is a great standard of care for our gorillas, that we are contributing all of this information in our population to the Gorilla Health Project.
I think this was a very unique opportunity for someone on the keeper level to make a significant accomplishment, something that really helped gorillas worldwide, not just the gorillas that we're working with every day.
As a trainer, it's very exciting to be able to do a new behavior like that, something you've never done before, something that is going to help everybody in the population is absolutely amazing.
Hopefully this presentation has helped you get an idea of how you can begin training your gorillas for cardiac ultrasound. Training this behavior allows care staff on all levels to meaningfully participate in the care of their gorillas. Cooperation from the gorillas decreases their stress while improving their welfare. The more participation we have from zoos housing gorillas, the more we can increase our knowledge and therefore prevention and treatment of cardiac disease in captive gorillas. Each time ultrasound images are submitted to the database, institutions are directly contributing to the welfare of gorillas throughout the North American population as well as around the globe.
Rivers of truth. I am the rhythm, the drum that dances on, a voice of the forest since dawn of creation. I am the song. Generations sing